Hi, hello. This is your psychiatrist, Dr. Cidambi, with another episode. I'm coming in today with this question and answer from one of the viewers who is asking why people with addiction, disease of addiction, refuse to stay in treatment. They are not continuing to stay in treatment. This is the topic, and I hope I can answer to this. So let's really talk about why is this non-compliance issues occur with the illness of addiction. This is because of internal and external triggers. So I think let me give you some. On the internal side, we talk about denial. 70%, nearly 70% of people who are battling the substance abuse disease, they downplay it, they are in denial, they block it. So you can see like 70%. It's a default sitting in the brain, like kind of the brain trying to protect from this overwhelming truth. And there is a fear. Here is the unknown. You're living with this addiction for years, and it's normal, as messed up as it may be. The thought of life without it, terrifying. A lot of people in recovery talk about this emptiness, the fear, the being in an unknown territory, the fear of being in that area. So on top of this internal thing, there's an external triggers. Imagine you're trying to crawl your way out of the deep hole and nobody is giving a hand up, nobody is pushing you down. But then you don't feel that nobody is giving you a hand up. You're constantly surrounded by triggers, and that's so common, unfortunately. And then there is a financial treatment. Treatment is expensive, and trying to figure out insurance and all other headache. And it's such a storm. You're caught in that storm of stressors. The term like ambivalence, self-determination. So what is ambivalence? This is the push and pull in the internal debate that is going on. One part of you wants it, the other part which is clings to what it knows, to the substance. So it's a constant back and forth, And then it's a self-determination theory. This one is big. Basically, it says we all need to feel three things: autonomy, we need to stay in our own lives; competence, and then connected to others, feeling supported. And the treatment feel forced, you feel you've been judged, so of course it's not going to work. So we are not just treating the addiction, we are treating the whole person wholesome, and we need to give them the coping mechanisms toolbox. And here now you throw on top of this neurobiological piece to it. There's a rewiring of the brain itself. And these cravings are so intense, so powerful. It's as if your own brain is acting against you. Knowing all of these layers, are there ways to make this treatment more effective, more engaging, so people who are watching this can stick to treatment? One is motivational interviewing. So the treatment provider should do the motivational interviewing to make them understand why they want to do this. And then you bring in therapy, family support, doing the one-on-one, where you're taking the pressure off of that individual, will make them line up for asking for treatment. Finally, flexibility should be the key element. Treatment should never be one size fits all. We have to tailor it to their needs, their individual triggers, their coping mechanisms, their need for these drugs, and their sabotaging behavior. With the right support and the right understanding, lasting recovery is possible. You give it so much to think about. And there's one thing that you can take away from today's session is that if someone is struggling from substance abuse, you're not just alone. And there is so much underneath, and if you have compassion, understanding, and are not judging you, will definitely help you achieve the goal of staying sober and staying in treatment. It's the pink cloud. The minute you get into treatment, you start feeling that I got this. As soon as the detox is over, you think, hey, I need to go back to work. My family needs me. But really think about this. How many years have you been using? And you just want the magic to happen within a week, 10 days. It's too much to ask, right? It's not going to happen. You need to really put your heart into this and say, this is it. I'm here. I'm going to ask for every piece of help that they can give it to me. And I tell you, the old model was the traditional model. When I say old model, it's a traditional model. When you have an addictive issue, you have to leave your family, go away, go inpatient, and you're totally disconnected from the society, from your family, and seek treatment. Now, thanks to outpatient ambulatory detox, you don't have to. You can go back to your own bed at the end of the day. You come in, you get the treatment, you go back home, you're with your children, you are able to work, and there is no stigma because no one even knows that you're getting this treatment. You may even be able to bring in your work because thanks to COVID, so many good things have also happened in spite of all the bad things that we have been through. It allows you to work from your home environment. So this hybrid model really helps you get your treatment and be able to work on the side too. So I would say that seek out for treatment. There's no need for you to sit there and think about when can I take time off. Make a phone call to the ambulatory outpatient centers, and we are located in New Jersey, and I'm the medical director for Center for Network Therapy. And please do, this is not the promotional video, I'm just telling you because listen, it is so hard to throw away your role in the community and seek treatment. Addiction is a chronic disease. It's like any other chronic disease like diabetes, high blood pressure, autoimmune disease. So you need to be able to go home, manage the other roles of lives, and get treatment. So we are here. Treatment is available. All you need to do is not cut short the treatment and really go through the layers of treatment, which is detox, then comes the partial care, and then comes the intensive outpatient. Put together 90 days is going to be difficult, and after that it gets easier. Get on that track to really seek help. You or your loved ones who's watching this today, if you needed treatment, there is treatment available. Where there is will, there is way. Thank you. Until the next time.